What is diabetes and how does it affect the body? Hi guys. Welcome to my channel. Before we get started, make sure to hit that like button. Also subscribe to my channel. What is diabetes and how does it affect the body? So make sure to watch the full video. What is diabetes? Diabetes mellitus is a condition that occurs when your blood sugar, glucose, levels get too high. It happens when your pancreas doesn't produce enough or no insulin, or when your body doesn't react properly to the actions of insulin. Diabetes affects people of all ages. Most forms of diabetes are chronic, lifelong, and all forms can be managed with medication and/or lifestyle changes. Glucose, sugar, comes mainly from carbohydrates in food and drink. It is your body's source of energy. Your blood carries glucose to every cell in your body for energy. When blood contains glucose, it needs help, a key, to get to its final destination. The key is insulin, a hormone. If your pancreas doesn't produce enough insulin or your body doesn't use it properly, glucose can build up in your blood, causing high blood sugar, hyperglycemia. Over time, persistently high blood sugar can lead to health problems such as heart disease, nerve damage, and eye problems. The technical name for diabetes is diabetes mellitus. Another condition shares the term diabetes insipidus, but they are different. They share the name diabetes because they both cause thirst and frequent urination. Diabetes insipidus is rarer than diabetes. What are the types of diabetes? There are different types of diabetes. The most common forms include type 2 diabetes. With this type, your body does not produce enough insulin, and/or your body's cells do not respond normally to insulin resistance. It mainly affects adults, but children can also suffer from it. Prediabetes. This type is the stage before type 2 diabetes. Your blood sugar level is higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys the insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people with diabetes have type 1 diabetes. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you are at higher risk of developing type 2 diabetes later in life. Other types of diabetes include type 3C diabetes. This type of diabetes occurs when your pancreas is damaged, other than autoimmune damage, affecting its ability to produce insulin. Pancreatitis, pancreatic cancer, cystic fibrosis, and hemochromatosis can all damage the pancreas and lead to diabetes. Removal of the pancreas, pancreatectomy, can also cause type 3C. Latent autoimmune diabetes mellitus in adults, LADA. Like type 1 diabetes, LADA is the result of an autoimmune response, but progresses much more slowly than type 1. People diagnosed with LADA are usually under 30. MODY, also known as monogenic diabetes, occurs as a result of an inherited genetic mutation that affects the way your body makes and uses insulin. There are currently over 10 different types of MODY. It affects up to 5% of people with diabetes and is usually hereditary. Neonatal diabetes. This is a rare form of diabetes that occurs during the first 6 months of life. It is also a type of monogenic diabetes. About 50% of babies with neonatal diabetes have a permanent form called permanent neonatal diabetes. For the other half, the disease disappears a few months after its appearance but can reappear later in life. This is called transient neonatal diabetes. Fragile diabetes. Fragile diabetes is a form of type 1 diabetes, characterized by frequent and severe episodes of hyperglycemia and hypoglycemia. This instability often leads to hospitalization. In rare cases, a pancreas transplant may be needed to permanently treat brittle diabetes. How common is diabetes? Diabetes is common. About 37.3 million people in the United States have diabetes, representing about 11% of the population. Type 2 diabetes is the most common form, accounting for 90 to 95% of all diabetes cases. About 537 million adults worldwide have diabetes. Experts predict that the number will rise to 643 million by 2030 and 783 million by 2045. Long-term effects of diabetes on the body beyond the symptoms. Diabetes can also cause long-term damage to our body. This long-term damage is often called complications of diabetes. Diabetes affects our blood vessels and nerves, so it can affect any part of the body. However, some parts of our body are more affected than others. Diabetes complications usually take years of poorly controlled diabetes to develop. Complications are not guaranteed and can be avoided and prevented. By maintaining strict control over diabetes, blood pressure and cholesterol, all of this can be helped by following a healthy diet, avoiding smoking and alcohol, and incorporating regular activity into your daily regimen to keep blood sugar levels within recommended limits. Effects of diabetes on the heart. Diabetes is closely related to coronary heart disease. Diabetes causes high blood pressure and is associated with high cholesterol, which greatly increases the risk of heart attack and cardiovascular disease. Diabetes and stroke. Similar to the effects of diabetes on the heart, high blood pressure and cholesterol can increase the risk of stroke. How diabetes affects the eyes. A relatively common complication of diabetes is diabetic retinopathy. Like all complications, this condition results from years of poorly controlled or uncontrolled diabetes. Diabetic retinopathy has many symptoms. Retinopathy is caused by swelling and leakage of blood vessels at the back of the eye, retina. High blood pressure is also a factor in diabetic retinopathy. Diabetic retinopathy is treatable, so it's best to catch it early. The best way to do this is to attend an annual retinopathy screening appointment, which the NHS provides free of charge. Effects of diabetes on the kidneys. The kidneys are another organ particularly vulnerable to damage from diabetes. Again, with diabetes, high blood pressure and poorly controlled cholesterol increasing the risk. Diabetic nephropathy is kidney disease caused by diabetes. Kidney damage can last for years and can be detected by kidney disease screening before it becomes too serious. Treatment includes lifestyle changes and may include medication to treat high blood pressure and cholesterol. Diabetes and its effects on the nerves. The effects of diabetes on the nerves can be serious because nerves are involved in many functions in our body, from movement and digestion to sex and reproduction. The presence of nerve damage, neuropathy, is usually manifested by lack of arousal of the penis or clitoris. Excessive sweating or diagnosis of delayed gastric emptying. Delayed treatment of stomach for pain relief. But medications, such as blood pressure medication, may also be prescribed to help prevent the onset of the condition. Diabetes and its effects on digestion. Diabetes can affect digestion in many ways. If diabetes causes nerve damage, nausea, constipation, or diarrhea may result. Another cause of indigestion can be the result of diabetes medications. For example, some drugs for type 2 diabetes tend to cause digestive problems, but these tend to lessen as the body adapts. How diabetes affects the skin. The effects of diabetes on the skin are usually due to its effects on the nerves and circulation, which can lead to dry skin, slow healing of wounds, burns and sores, fungal and bacterial infections, and loss of sensation in the feet. People with diabetes are advised to have their feet checked at least once a year. The effects of diabetes on the feet are often referred to as diabetic feet. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.